Well, right now, deep inside your body, a silent but absolutely vital process is unfolding. It doesn't ask for your attention, it doesn't even pause when you sleep, but the very survival of your internal ecosystem depends entirely on it. Welcome to this explainer. Today we're stepping into a true masterclass in kidney care, and we're drawing this directly from the frontline experience of a government hospital head nurse. We're going to pull back the curtain on the invisible mechanics of hydration and expose how the simplest daily habit might actually be the exact thing that's quietly tearing down your renal health. So I want you to just stop and think about this for a second. How much water did you actually drink yesterday? Can you picture it? And actually, more importantly, how did you drink it? Were you barely touching a glass all morning and then suddenly trying to just chug a massive bottle all at once in the late afternoon to catch up? And here's an even more critical question for you. Did you wait until you felt that dry, sort of scratchy sensation in the back of your throat? Did you wait until your body was actively screaming for hydration before you finally took a sip? Because if you're nodding your head to any of this right now, you might actually be making the most common, fundamental mistakes in kidney care without even realizing it. Our source material comes from a medical professional who sees a genuinely heartbreaking reality on the front lines every single day. We're talking about patients who do everything right. They take their medications, they meticulously watch their diets, they show up to every single appointment. But because of exactly how they consume their water, they're quietly working against everything else, completely undoing their own hard work. You see, water is your kidney's most essential tool, but it really only works if it's used correctly. Let's dive into Section 1, the morning kidney crisis. Think about the average morning routine. You wake up, maybe stumble into the kitchen, brew a cup of coffee, scroll through your phone for a bit, and you probably don't even think about a drop of water for the first hour or two. Now, contrast that with the optimal kidney routine, drinking a full glass of plain water the absolute first thing you do. So why is this difference literally life-changing? Well, it's because for 7 to 8 hours while you were fast asleep, your body was completely without water. Your blood became noticeably thicker. But here's the thing, your kidneys didn't sleep. They kept right on working, filtering that thicker blood with far less fluid than they actually needed. And over those hours, toxic waste products like creatinine, uric acid, and uremic toxins rapidly built up. That very first glass of water in the morning, it isn't just a refreshing drink, it's a critical medical flush. It's the immediate relief your organs have literally been begging for all night. It absolutely must be a non-negotiable habit. All right, moving on to Section 2. Why timing is everything. There's a really powerful aha moment we all have to accept here. Thirst is a late signal. When we drink reactively, meaning waiting until we actively feel thirsty, we're already way behind. By the time that dry signal actually registers in your brain, your body has already crossed the threshold into mild dehydration. And when you cross that line into mild dehydration, your blood concentrates. It gets heavier, it gets thicker. Your kidneys now have to work significantly harder just to push that dense fluid through their incredibly microscopic filters. This extra strain directly damages the tiny, really delicate blood vessels inside your kidneys. For every single hour you spend in this state, you're basically forcing your internal architecture to operate under extreme, completely unnecessary pressure. And this is exactly why we have to shift from reactive to proactive hydration. Reactive hydration is harsh. It's basically starvation followed by a massive flood. Chugging huge amounts of water late at night to catch up is deeply, deeply stressful to your system. Instead, the protective, gentle rhythm your kidneys actually crave is proactive hydration. We're talking small glasses of water spaced out evenly every 1 to 2 hours, just a steady, manageable flow. Which brings us to Section 3. The danger of overhydration. Now, we need to shift to a very serious warning here. Healthy kidneys will automatically filter out excess water, but damaged kidneys, they just can't. For patients dealing with stage 3 or stage 4 chronic kidney disease or anyone on dialysis, pouring too much water into a system that simply can't process it is a literal medical emergency. Excess fluid leads to severe water retention, incredibly dangerous swelling, skyrocketing blood pressure, and terrifyingly, something called pulmonary edema, which is quite literally fluid drowning your lungs. This is precisely why, if you are a dialysis patient or have advanced CKD, your medical team is going to give you a strict daily fluid limit. This is not a casual suggestion. It's not a rough guideline where you can kind of eyeball it. As our frontline source heavily emphasizes, these limits exist for life-saving reasons, and they must be followed exactly to the milliliter. You absolutely must have this conversation directly with your nephrologist. But what if you have moderate CKD and you're still producing normal amounts of urine? How do you know if you're getting it right? Well, the visual indicator is actually remarkably simple. Look at your urine. You're aiming for a pale yellow color. If it's dark yellow, you're definitely underhydrating and your blood is concentrating. But if it's completely clear, like tap water, you're likely overtaxing the system and drinking way too much.
Let's look at section 4, what you actually drink.
Beverage toxicity varies wildly. Take fizzy or even diet sodas, for instance. They are absolutely loaded with phosphoric acid. Damaged kidneys can't filter phosphorus, which leads to weakened bones and serious vascular damage. Just a single can causes real harm. Energy drinks? An absolute categorical disaster full of sodium and caffeine. Now, coffee and tea are acceptable in strict moderation. Think 1 to 2 cups, but you really have to watch your blood pressure. But then consider lemon water. A simple slice of lemon contains citrate, which is a compound with immense evidence-backed power to reduce kidney stone formation. It quite literally acts as medicine for your body.
However, the undisputed king of kidney care is always going to be plain water. Filtered if possible, of course. But notice this very specific medical detail. It should be at room temperature or even slightly warm. Why is that? Because ice-cold water actually causes mild vascular constriction inside your body. That forces your system to do unnecessary extra work just to warm it up. Room temperature water is the ultimate, frictionless tool for your kidneys.
Let's pull this all together in section 5, the daily hydration routine.
So here is a fantastic proactive daily timeline you can follow. Morning, get that critical full glass of plain water in for the overnight flush. Mid-morning, around maybe 10 a.m., have a small glass, perhaps with your medications. At lunchtime, moderate water to aid digestion, but don't overdo it to avoid fluid overload. Now, mid-afternoon, this is the danger zone where most people completely forget. Go ahead and set an alarm on your phone right now to remind you to drink a small glass. And finally, the evening. Taper off your fluid intake 2 full hours before bed. This prevents overnight fluid retention and stops nighttime urination from destroying your restorative sleep. As always, make sure to discuss this exact framework with your care team. As we wrap up, I want to leave you with one very specific number, 180. That is exactly how many liters of blood your kidneys filter every single day, 180 liters. They regulate your blood pressure, they balance your minerals, and they control your fluid volume without taking a single moment's rest, 24 hours a day for your entire life. Which brings us to our final, pretty profound question. Knowing they work this hard for you, knowing the monumental, invisible task they perform every single second, are you giving your kidneys the exact tools they need to survive? Or through your daily habits, are you quietly working against them? Look, good hydration is free. It's the absolute simplest intervention you have at your disposal. Make the choice today to stop fighting your body and start supporting it. Thank you so much for joining me for this explainer. Keep learning, keep questioning, and please take care of yourself.